What is high altitude cerebral edema? HACE. Very interesting question. Lately, we've been getting a lot of questions about how altitude affects the brain, and this is the big one. So high altitude cerebral edema generally occurs above 4,000, 5,000 meters, so way, way high. It's not like this is likely to happen if you just go up your local hill. You typically got to be way, way high. Can it happen lower? Yes, but even when it's lower, we're still talking very high altitude. And again, it's very rare. Maybe only about 1% of people exposed to that altitude would ever get this syndrome. What's happening is that because of the lack of oxygen, hypoxia-induced changes in the brain, the vessels dilate. Those vessels get much bigger. That causes the vessels to become leaky, and then fluid begins to leak out of those vessels into the brain tissues, and that causes swelling, and it's the swelling that causes the problem. So what do we have to do once we notice it? We have to get somebody down. We want to get at least 1,000 meters from the onset of the symptoms. Once they're 1,000 meters below that, generally they can be stabilized, but it's very, very important to recognize it quickly. And some of the first signs are going to be confusion, what's often called altered mental status, sort of confusion, sleepiness, sluggishness, errors in decision making that somebody wouldn't normally make. And then another big one is what's called ataxia, or really a loss of coordination. So those are the major findings on examination for somebody who's having this, and we have to get those people down to a lower altitude as quickly and safely as possible.